You know, you see those big, energetic dogs, right? Like a lab or a golden, maybe chasing a ball, seems totally fine.
Yeah, absolutely.
But then maybe later you notice them finding it a bit hard to get up. Or they seem, I don't know, a little stiff.
Hmm.
Or maybe, a friend's German Shepherd starts limping a bit after a long walk. It definitely makes you wonder what's actually happening there.
Exactly. And those little things, they can actually be clues. Clues to something pretty common and quite significant in dogs. Canine hip dysplasia.
Ah, right.
So that's what we're going to dig into today. It's this skeletal condition, and it's a big reason why dogs develop osteoarthritis in their hips.
Okay. So for this deep dive, we've got some really good information pulled together. And the goal really is to pull out the key stuff for you listening.
Right.
We want to get a handle on what hip dysplasia actually is, why it happens, how vets figure it out, and crucially, what can be done to help.
Yeah, give you that clear picture without getting bogged down in all the heavy jargon.
Exactly. So let's unpack it. What is canine hip dysplasia, basically?
Okay, so in simple terms, it's a developmental problem. It affects the hip joints. You can sort of imagine the genetic plan goes a bit wrong.
Mm-hmm.
And the hip joint, while it's still growing, doesn't fit together snugly. It's
Huh.
what vets call subluxation.
Subluxation, like a partial dislocation.
Exactly like that, a kind of slipping. And that poor fit, that's really the first domino to fall.
A domino effect. Okay, interesting. So what happens next after that initial kind of loose fit?
Well, because the ball part at the top of the thigh bone, the femoral head, isn't sitting deep in the socket, the acetabulum.
Right.
It creates these weird, uneven forces across the joint. And that messes up the normal way the bone should develop.
Ah, okay.
So you often end up with a socket that's too shallow and maybe the ball part gets a bit flattened, and this weird shape puts way too much stress on the cartilage.
The cushioning part.
Exactly, that smooth lining. And that constant overload, it leads to tiny bits of damage, microfractures we call them. And eventually, boom, osteoarthritis, painful joint degeneration.
Wow. So it really starts with that development going wrong.
Yep, primarily affects the musculoskeletal system's development.
So you mentioned genetics. It sounds like that's a huge part of this. Is it just like one bad gene?
Oh, if only it were that simple. No, it's what we call polygenetic,
Meaning,
meaning multiple genes are involved, all working together, or maybe not working together quite right. It's not just one switch.
okay.
And what's really key here, it's not just the genes. Environment plays a big role, too.
Like nature versus nurture.
Exactly. Things like their diet, especially when they're puppies and how fast they grow,
Hmm.
those things can really influence if the dog develops it and how severe it gets.
Huh. So even if a dog has the genes for it, you might be able to influence the outcome a bit.
To some extent, yes. Careful management, especially early on, can make a difference. That's why you can't just look at the parents sometimes. The whole picture matters.
That's fascinating. And I guess this varies a lot between breeds.
Oh, absolutely.
Hmm.
The chances of a dog getting hip dysplasia, we measure that with something called the heritability index.
Right.
That index varies a lot.
Mhm.
Some breeds, genetics just plays a much stronger role than in others.
Mhm.
Really shows how strong that genetic link is.
Okay, so just how common are we talking here? Is this something vets see occasionally or?
No, it's unfortunately really prevalent. It's honestly one of the most common skeletal problems vets deal with in
No.
dogs.
Wow.
We don't have like one exact number for all dogs because it really does depend so much on the breed, but yeah, it's widespread.
And you mentioned cats earlier. Less common in them.
Significantly less common, yes. They can get it, but nowhere near as often as dogs.
So, focusing on dogs then, are there specific breeds that owners should be particularly aware of?
Yeah, definitely. It leans heavily towards the large and giant breeds.
Like who?
Think St. Bernards, German Shepherds are a big one. Labs, Goldens, Rottweilers.
Mm.
Those kinds of dogs tend to pop up frequently. But it's important to remember, smaller breeds can get it too. They just might not show the obvious signs as much because, well, their joints don't have as much weight to carry.
Right, that makes sense. And for cats, you said it's rare, but any specific breeds there?
It tends to show up more in purebred cats. Maine Coons are probably the most cited example. There's data suggesting maybe around 18% incidence in Maine Coons.
18%. Wow. That's quite specific.
It is, yeah. Higher than your average domestic shorthair, for sure.
Okay, so when does this usually start causing noticeable problems? Is it an old dog disease?
Well, the underlying issue, the poor fit, that actually starts when they're puppies, when those joints are still forming.
Ah, so really early.
Right. But when you actually see the signs, the limping or stiffness, that can vary a lot. It depends on how loose the hips are to begin with, and then how quickly that osteoarthritis sets in.
So it could be young or old.
Exactly. In really severe cases with very loose hips, you might see signs in a puppy as young as 4 months old.
4 months. Wow.
Yeah. But other dogs, maybe the looseness isn't as bad. They might not show obvious problems until they're middle-aged or older, when the arthritis really starts causing pain.
Mm.
So it can appear at almost any age, really.
Got it. And does it affect males or females more?
In dogs, it seems pretty equal. We don't really see a significant difference between males and females.
Okay.
But in cats, interestingly, the reports suggest it might be a bit more common in females.
Interesting difference. Okay, so let's talk about spotting it. What are the actual red flags an owner might notice at home?
Yeah, the signs can be subtle at first, especially early on when it's mostly about the looseness, the instability.
Hmm.
Later, the signs are more related to the pain from the arthritis.
Okay, so what kind of clues, just from watching their dog day to day?
One big one is just a general decrease in activity. Maybe your dog isn't as keen to play fetch for as long or gets tired on walks sooner. Difficulty getting up is a classic sign, like struggling to push themselves up from lying down, seeming really stiff first thing. Reluctance to do things they used to do easily, jumping on the sofa, running upstairs, hopping into the car. That makes sense.
You might also see lameness in the back legs. Sometimes it comes and goes. Sometimes it's always there. Often it seems worse after they've had a good run around.
Okay.
And then there are changes in how they move. That bunny hop gait is quite characteristic. They move both back legs together when they run.
Oh, right. I think I've seen that.
Yeah. Or sometimes a swaying walk, kind of like Marilyn Monroe, a bit wobbly in the back end. And you might notice they stand with their back legs closer together than usual, a narrow stance.
Okay, lots of potential clues there.
Yeah.
And what about when they get to the vet? What might the vet find during the exam?
During the hands-on exam, the vet might find pain when they extend the hip or move it around.
Okay.
Early on, a key finding can be increased joint looseness. There's a specific test called the Ortolani sign, or Ortolani maneuver.
The vet gently manipulates the hip, and if it's loose, they can sometimes feel or even hear a clunk as the femoral head slips out of and back into the socket. It's a really important sign for early detection.
But you might not always feel that.
Correct. In dogs with chronic arthritis, the tissues around the joint can thicken up and sort of stabilize it falsely, so the Ortolani sign might disappear even though the underlying problem is still there.
Okay.
The vet might also feel a grinding sensation. We call it crepitus when moving the hip. They'll likely notice the hip doesn't move as freely, a reduced range of motion. And often you'll see muscle lock or atrophy in the thigh muscles because the dog isn't using that leg properly due to pain.
Right, the body compensates. So we know the main cause is that genetic tendency for loose hips. But you mentioned other factors influence it. Can we go back to those?
Yeah, absolutely. So genetics sets the stage, but other things definitely influence the play.
Like what?
Rapid weight gain is a big one, especially in growing puppies. Putting too much weight on those developing joints can really worsen the stress and damage.
Okay, so diet's important.
Diet quality, yes, and specifically managing growth rate in those large breeds prone to it. Also, believe it or not, the amount of muscle mass around the pelvis can help. Good muscle tone can provide a bit more support to the joint.
Oh, interesting. So it's a mix of things. Now, if an owner sees these signs and brings their dog in, how does the vet actually diagnose hip dysplasia and rule out other stuff?
Good question. The first thing is to consider other possibilities. Hind limb lameness can be caused by lots of things.
Such as?
A torn cruciate ligament in the knee is common. Spinal issues like disc disease. Other joint problems, maybe in the knee or ankle. Even just growing pains, pancreatitis, in young dogs. So you have to differentiate.
Okay, so rule those out first, then I'm guessing x-rays are key.
Absolutely crucial. Standard x-rays are the main tool. Usually we take a specific view with the dog lying on its back, legs extended straight back. It's called the ventrodorsal hip extended view.
And getting that position right is important.
Critically important. For an accurate assessment, the dog needs to be perfectly still and positioned correctly. That often means sedation or even general anesthesia is needed.
Okay. And what do you look for on those initial x-rays, maybe in a younger dog?
Early on, you might primarily see signs of that looseness, the poor fit. The ball isn't sitting deeply in the socket, but the actual shape of the bones might still look fairly normal at this stage.
So the damage hasn't happened yet, just the instability.
Pretty much. But as it progresses, you start to see the changes to the bone shapes. The socket, the acetabulum, tends to become shallower. The ball, the femoral head, can start to flatten and lose its nice round shape.
And later on, when arthritis is set in, what shows up then?
Then you see all the classic signs of osteoarthritis on the X-ray. That flattening of the femoral head and shallow socket become more obvious. You'll often see bony spurs, called osteophytes, forming around the edges of the joint.
Like the body trying to stabilize it.
Kind of, yeah. But it's abnormal bone growth that causes pain. You might also see thickening of the femoral neck, the part just below the ball, and increased bone density under the cartilage, which we call subchondral sclerosis. Even the soft tissues around the joint can look thicker due to inflammation.
You mentioned something about cats being different here.
Oh, yeah. Interestingly, cats with hip dysplasia don't usually show that same thickening or remodeling of the femoral neck that's so common in dogs. Little species difference there.
Huh. Are there other types of x-rays used? You mentioned measuring looseness.
Yes, there are special techniques. Distraction radiography is one. It involves using a device to gently push the hips apart while taking the x-ray.
I do that.
It allows us to actually quantify how loose the joint is, measure the distraction index. It can sometimes make the looseness much more obvious than on the standard view.
Okay.
There's also another view, the dorsal acetabular rim view, which helps assess how well the top edge of the socket is covering the femoral head. Gives more info about the joint structure.
So those x-rays show the physical shape, what's actually happening inside the joint tissue itself.
If you were to look at the tissue, early on, like we said, bones might look okay, but you'd find that looseness and probably extra joint fluid, the synovial fluid,
Got it.
as it progresses, you see the malformed bones we talked about. The joint lining, the synovium gets inflamed, that's synovitis, and the cartilage, that smooth protective layer, starts to break down, gets thinner, maybe frayed.
And in really bad chronic cases.
You can get complete loss of cartilage in areas, just bone rubbing directly on bone, which is incredibly painful.
Ouch. Okay, so diagnosis made. Now the big question, what can be done? What are the treatment routes?
Right, treatment. It really is tailored to the individual dog. There's no one-size-fits-all answer.
What factors do you consider?
We look at the dog's size, their age, what kind of life they lead. Are they a working dog or a couch potato? How loose is the joint? How much arthritis is already there? Then there's the vet's experience and preference, and realistically, the owner's budget comes into play too.
Makes sense. So broadly, what are the main approaches?
Generally, we think about it in two main categories: supportive or medical management and surgical options.
Okay, let's start with the supportive care, the non-surgical stuff. What does that involve?
Physical therapy is huge. Things like passive range of motion exercises, where you gently move the dog's hip through its normal movement, helps fight stiffness and keeps the muscles working.
Okay.
And hydrotherapy swimming, basically, or using an underwater treadmill is fantastic. It lets them exercise and move the joint without the impact of bearing weight. Great for building muscle, too.
And just their general activity levels. Rest them completely.
Not usually, no. It's more about finding the right balance. We encourage as much comfortable activity as they can handle. Swimming is great, like I said. Low-impact walks on leash are good.
What should they avoid?
High-impact stuff. Lots of running, especially on hard surfaces, jumping, sharp turns, anything that clearly makes them sore afterwards. Controlled, moderate exercise is usually the way to go.
And diet. You mentioned weight gain earlier.
Absolutely critical. Weight control is probably one of the most important non-surgical things you can do. Every extra pound puts more stress on those painful joints.
Right.
So keeping them lean is key. And sometimes dogs get less active because they're sore, which makes weight gain easier, so you have to be vigilant.
Any specific food ingredients or supplements?
Omega-3 fatty acids are often recommended, found in fish oil, for example. They have anti-inflammatory properties that can help reduce joint pain and maybe improve function. Many therapeutic diets for arthritis include them.
Got it. And what about talking to the owner? What do you need them to understand?
Client education is vital. They need to understand this is inherited. They need to know that medical management pills, therapy pills, it manages the symptoms, the pain and stiffness. It doesn't fix the underlying loose joint.
So the arthritis might still get worse?
Often, yes, the degeneration can continue over time without surgery that addresses the mechanics, especially if started early. But it's also important they know that surgery can make a huge difference, even in dogs with pretty bad arthritis. It can restore function and relieve pain significantly.
Okay, so let's talk surgery then. What are the main surgical options?
There are a few, and again, it depends on the dog's age and the state of the hip. For young dogs, say 6 to 12 months old, with loose hips, but not much arthritis yet, There's a procedure called a triple or double pelvic osteotomy, PPO or DPO.
What does that do?
It involves cutting the pelvic bone in 2 or 3 places and rotating the socket part, the acetabulum, to cover the femoral head better. Think of it like adjusting the angle of the cup so the ball sits more securely inside.
Aiming for a better fit.
Exactly. Improve the mechanics, reduce the abnormal forces, and hopefully slow down the progression of arthritis significantly. The dog might still develop some arthritis later on x-rays, but clinically they often do much, much better.
Is there anything for even younger puppies?
Yes, there is. For very young pups, usually between about 8 and 16 weeks, ideally 12, 16 weeks, there's something called juvenile pubic symphysiodesis, or JPS.
That sounds complicated.
It's actually minimally invasive. It involves using heat, basically, to fuse a specific growth plate at the bottom of the pelvis. By stopping growth there, it encourages the rest of the pelvis, including the sockets, to grow outwards, improving coverage of the femoral heads.
Wow, that's clever.
It is, and it can work really well if done at the right, very specific early age, much less effective after about 5 months old.
Okay, what about older dogs, the ones who already have painful arthritis?
For mature dogs where the arthritis is bad and medical management just isn't cutting it anymore, the gold standard is often total hip replacement, THR.
Like in humans.
Exactly like in humans. You replace the damaged ball and socket with artificial implants, usually metal and plastic.
And how successful is that?
Very high success rate. It's excellent for relieving pain and restoring pretty much normal function. It's a major surgery, of course, often done one side at a time, though doing both is becoming more common. There are potential complications, infection, dislocation, nerve damage, but overall it can be life-changing for the dog.
Are there other options if THR isn't feasible, maybe due to cost or the dog's health?
Yes, another common procedure, often considered a salvage option, is the femoral head ostectomy, or FHO.
What does that involve?
You basically remove the femoral head and neck the ball part of the joint.
Just remove it. What happens then?
The body forms a false joint out of scar tissue. It eliminates the painful bone-on-bone grinding.
Does that work well?
It works best in smaller, lighter dogs under, say, 40, 50 pounds who have good muscle mass. They can often function really well, almost normally. And larger dogs can still provide good pain relief, but they might always have a bit of an abnormal gait. Muscle rehab afterwards is really important for FHO success.
Okay, and there was one other mentioned, denervation.
Right? Denervation of the hip capsule. That involves surgically cutting the sensory nerves that supply the hip joint capsule. The idea is to stop the pain signals from reaching the brain.
Does it work?
The evidence is pretty limited, honestly. It doesn't fix the underlying mechanics or stop the arthritis. Most studies suggest it doesn't offer significant long-term improvement, though maybe some short-term relief is possible for some. It's not a go-to procedure for most surgeons.
Got it. So, moving away from surgery now, back to medications, what's the main role there?
Medications are all about managing the symptoms, pain and inflammation. That's the primary goal.
What kind of drugs are used?
The mainstays are non-steroidal anti-inflammatory drugs, NSAIDs. They reduce pain and inflammation in the joint. This helps the dog feel better, move more comfortably, and can help reduce that muscle loss that happens when they're reluctant to use the leg.
But they don't fix the hip.
No, absolutely not. It's symptom management. The underlying looseness or arthritis is still there and likely progressing. It's about improving quality of life. Common NSAIDs are drugs like carprofen, meloxicam, daracoxib, faracoxib. There are several options.
And the omega-3s you mentioned.
Yes, omega-3 fatty acid supplements are often used alongside NSAIDs or sometimes on their own in milder cases to help reduce inflammation.
Are there meds to avoid?
Yeah, generally yes. Corticosteroids like prednisone are usually avoided for long-term management of hip dysplasia arthritis.
Why is that?
They have more potential side effects long-term, and some evidence suggests they might actually harm cartilage over time, so not ideal for a chronic condition like this.
Okay. Any warnings about the NSA leads? Side effects?
Yes, NSAIDs can cause stomach upset vomiting, diarrhea in some dogs. That's probably the most common issue. Less commonly, but importantly, they can potentially affect the kidneys or liver. Carprofen, for example, had rare reports of liver issues, especially in labs, though it's still widely and safely used. Regular monitoring with blood tests is often recommended, especially for long-term use.
Right. What about those joint supplements you see everywhere? Glucosamine, chondroitin?
Ah, yes. Glucosamine, chondroitin sulfate, polysulfated glycosaminoglycans, they fall into the category of chondroprotectants or nutraceuticals.
Do they protect the cartilage?
That's the theory, or the hope. The idea is they might provide building blocks for cartilage or have some mild anti-inflammatory effects. However, the scientific evidence for their effectiveness in dogs with hip dysplasia or significant arthritis is, well, it's pretty mixed and often underwhelming.
So maybe helpful, maybe not.
Pretty much. Many vets feel they're unlikely to cause harm, so they might be included as part of a multimodal plan, but they're rarely relied upon as the sole treatment, especially for moderate to severe cases. Recent reviews tend to suggest minimal benefit.
Okay, so whether it's medical or surgical treatment, follow-up seems crucial.
Absolutely essential. Regular vet checkups are needed. If a dog's on medical management, we need to monitor if it's still working. Are they getting more painful? Do we need to adjust meds, add something else, or maybe now consider surgery? And if they've had surgery, follow-up is critical too. We need checkups and often follow-up x-rays to see how things are healing, make sure implants are stable if they were used, check the drain alignment, and monitor how the arthritis is doing long-term.
Right, makes sense. We've covered diagnosis and treatment really well. What about preventing this in the first place?
Prevention is tough because of that strong genetic component, but responsible breeding is the absolute cornerstone. Meaning, fundamentally, don't breed dogs that have hip dysplasia.
How do breeders know?
Screening programs are key. Organizations like the OFA Orthopedic Foundation for Animals in the U.S., or similar schemes elsewhere, evaluate pelvic x-rays taken under specific protocols. They grade the hips, excellent, good, fair, borderline, or dysplastic, mild, moderate, severe. Reputable breeders will screen their breeding dogs and only breed those with good or excellent hips.
Does that guarantee the puppies won't get it?
Unfortunately, no. Because it's polygenetic, even dogs with normal hips can carry some of the bad genes and potentially pass them on. But screening significantly reduces the risk. It's about playing the odds.
What else can breeders do?
Look at the bigger picture. Avoid breeding dogs whose siblings or parents had bad hips. Avoid repeating breeding pairs that had produced affected puppies in the past. It's about using all the information available.
And anything owners can do with puppies, diet-related.
Yes, there's good evidence, especially for large and giant breeds, that controlling growth rate can help reduce the severity if a dog is genetically predisposed. Feeding a high-quality large breed puppy food, which is typically less calorie-dense and has specific calcium-phosphorus ratios, helps promote slower, steadier growth. Avoiding oversupplementation, especially with calcium, is also important.
So don't let them get fat and grow too fast.
Exactly. It won't prevent it in a dog destined to get it, but it might make the difference between mild and severe disease.
Okay. So wrapping up the outlook. If a dog does get diagnosed, what's the prognosis?
The reality is that the joint degeneration, the arthritis, usually does progress over time to some degree. It's a chronic condition.
But can they live a good life?
Absolutely. The vast majority of dogs with hip dysplasia can live long, happy, comfortable lives with the right management, whether that's medical, surgical, or often a combination. It requires commitment from the owner, but the outcome is usually very positive in terms of quality of life.
That's really good to hear. Okay, so just to quickly recap the main takeaways here. Canine hip dysplasia, it's common, especially in bigger dogs, starts with a genetic tendency for loose hip joints, which then leads to arthritis.
Right. Developmental problem, really.
Signs can be subtle at first: stiffness, slowing down, trouble jumping, then maybe more obvious lameness. Vets diagnose with exams and definitely x-rays.
Ruling out other causes, too.
And treatment really varies. Can be managing symptoms with weight control, appropriate exercise, physical therapy, pain meds like NSAIDs.
Omega-3s, maybe, yeah?
Or it could involve surgery, especially for younger dogs to correct the fit, or for older dogs with bad arthritis, things like total hip replacement or FHO.
Lots of options depending on the situation.
And prevention really hinges on responsible breeders screening their dogs and making smart choices.
That's the key to reducing it long term.
So for you listening, if any of this sounds familiar with your own dog, definitely worth a chat with your vet.
Absolutely. Don't wait if you're concerned. And if you're thinking of getting a dog, especially one of those predisposed breeds, ask the breeder about hip screening. Ask to see the OFA or equivalent certificates.
Good advice. And just a final thought to leave you with. We've talked a lot about the biology, the mechanics, the treatments, but think about the other side of it. What are the sort of hidden impacts, the emotional toll maybe on the dog dealing with chronic discomfort and on the owner managing it day in, day out? How does navigating something like hip dysplasia change that relationship, that bond? Something interesting to consider beyond the x-rays and the pills.